I have my two colleagues from WHO, and I must say that if this initiative took shape, it is thanks to the wonderful, what I call the dream team at WHO. Our friend Dr. Alain Labrique, Derek Mooney, who was here, Pascoal sitting at the back, Salim, and I can narrate one example. I could say the simplicity and the participation of this team. When we gathered around this room, we wanted to change the format, and Salim came forward saying, "Can I help you arrange the chairs?" I would never expect that leadership 20 years ago when we started. I think we salute you, and today, if you have put digital health on the world map and it's implemented, it's thanks to the leadership team here at WHO. I think the floor is yours, Salim and Pascoal, and I want you to address this audience. But thank you so much for coming in. Be with us all throughout.
I'm gonna be very brief for all this. So just quickly, like what we heard today, I think like there's lots of connections that are happening. There's lots of people I know here, like Unkap, like Sophie, Caroline. Yeah, you too, for sure. And I think the idea behind what's happening here is like to connect people, and then we cannot do it alone. There is no way to do it alone. We need to bridge the gap between us and make sure that things happen. It's why there is this banner behind me, which is called the Global Initiative on Digital Health, which is a network of network. And it's just to show you what's happened with this kind of initiative. For example, UNCAP is related to Sophie right now with the GIDH, he mentioned it, the GTCOP, the Global Telehealth Community of Practice. With Caroline, there is like the cross-border, and then I think Huda, where is Huda? She was here somewhere. Here we go. Is connected because actually she put like some use cases for a paper we were writing on cross-border that we actually we were together just last week in Saudi Arabia to bring like some findings that we had with WTO and Caroline. So I think like what I would like to happen is that the people that I don't know that are connected, the networks that we heard, like the lady nodding right there, right now. I would love that like we connect, and then we bring in like that next time when we do an event like this, that actually everybody knows everybody. That everybody is doing something with somebody. So that's the idea behind, and that's the idea behind the guide. Like Caroline mentioned, for example, there is a toolbox that is within guide, one of the pillars, Implementum, Digital Health Atlas, that like allows like landscaping of solutions that we do in clinics with different countries and so on. So I would like that like we have more to say the next time, and that's the idea behind. And maybe I'd like maybe my colleague here to just say some words on like how to engage with Guide. There is an event happening in June, so I give the floor to Pascoal.
Thank you very much, Salim. First of all, hello everyone, also hello to who is online. I want to say a special thanks to Professor Agenda. It's been since 2019 that we start our Department of Digital Health and Innovation. That Professor Agenda came to ourselves to say, I'm here to support. We started telemedicine, we started different initiatives, different management team cross around our department, and Professor Agenda was always very, very faithful to close to us. Thank you very much, Professor Agenda. And of course, I want to say also thank you very much to the University of Geneva. It's one of our WHO collaborative centers, which work very, very close with our Department of Digital Health and Innovation, support us preparing some papers, documentations, in particular the new training or capacity building program on telehealth. Thank you very much, Caroline, Professor Anton Gansbuller, and all the team. As my colleague Salim just mentioned, so we have our guide, as we call it at home guide, you can also call it guide, it's the Global Initiative on Digital Health. This initiative is a WHO-hosted network where we bring the network of networks, the actors working on digital health programs, initiatives, political alignments, even financial and other kinds of resources. Last year we launched our first convening guide workshop when we bring in person different partners. This year, despite the different challenges that we have, we're gonna come again with the second convening workshop. This time we will 100% online. What we want to say is that we keep working together, and this initiative from Professor Agenda is also something that we're going to engage you on GIDH. And I saw some of you, and I heard some institutions, you're already a member of GIDH. This is what we try to bring together resources to, in one common voice, address the people who will receive our initiatives, which is the end users and member states. Just very, very briefly, the second convening GIDH workshop will have three main objectives. The first one is to discuss and identify priorities, actions of the anticipated extensions of our global strategy on digital health. You can identify some of the brochures outside, but you can also identify it online. The second objective is also to discuss key terms to be considered in the anticipated renewal of the global strategy. And the third objective is to map pathways together. It means how collective partnerships and network collaborations can plan, finance, and execute a sustainable and country-level digital transformation. I think, on behalf of my management team, I want to say WHO cannot leave no one behind, but we cannot also work alone. We are all together, and this initiative, your presence here, is very, very welcome to us. Thank you very much.
Thank you, Pascoal. Thank you, Salim. And I think I can assure you that of my years of working with this team carries everyone along.